there, and how are you doing? Welcome back to Inside Recovery episode 2. My name is Milka, and today we are diving into a very important topic: rehabilitation programs. Probably you ask yourself, what are these programs we are talking about? What happens in those programs? And the last question, how do families know the best fit for their loved ones? Today I am joined by an amazing guest. He is a counselor, a therapist, and you know what? Let him introduce himself better.
Hello everyone, my name is Kevin Mugo. I'm a therapist and I'm also a counseling psychologist, and among the team members in New Chapter Rehabilitation and Counseling Center, and I'm looking forward to have an engaging moment the next few minutes that you'll be here so that we may learn together more about this man called addiction. Yeah.
Thank you so much. There is our guest counselor therapist. Hizo zote zenye amesema, and not forgetting he's from New Chapter Place. You remember ile nini yetu ya kwanza tulisema this program is brought to you by NCP, New Chapter Place Counseling and Rehabilitation Center hapa Kawasukari. So Kevin,
yes,
hapa me and our viewers, tunasemaga tumekuja kulearn.
Yes.
And today, before you came, I told them we want to talk about rehabilitation programs.
Wow.
I know you know it. You're a counselor. Yeah. I know you know all the programs that zinakuaga. So I want you to to help us understand what are these programs that zinakuaga uko kwa rehab. Yes.
Wow. To our viewers, we have two major programs. We have the inpatient and the outpatient. And now for the inpatient, it's where now these clients get maybe admitted, and we stay with them in the facility. Now for the outpatient program, it's when now this client, they come for the sessions when they are given an appointment. That's a major difference. So we have two major programs: the
inpatient and the outpatient
program,
Fantastic. So what does an inpatient program typically inakaga? An inpatient program? Yes.
Now in the inpatient program, allow me just to explain the process.
It's all right.
Now the first one, we begin with admission. Now this client, in fact not even the admission, we begin from inquiry. You get a phone call from maybe this family or the sponsor of the client, get a phone call. Then now after this family or this sponsor akisha kwa satisfied, they come to the facility to come and see where are we taking our loved one. Now when they come after now get agreeing together, now the admission begins. They bring in their clients, we begin with the admission. Now we go to the next step, that is assessment, which takes about 1 to 3 days, because we must do that assessment. Now after that assessment, now when we do the assessment, now we get to the next step is we get in the doctor does the assessment. Now we have the psychologist on board, we have the counselor on board, we have the psychiatrist on board, we have the social worker on board. So all these people, they are helping us do this assessment to this client. Now after that, now the next thing that we do now, this client begins the program, and that's another question is coming.
Yes.
How does it? I don't know whether jump
actually that's a good process by the way.
Nice.
Yes.
Now when these clients are mekuja, the first month, in fact the program is divided into 3 months. Personally, I divided into 3 months. The first month I call it the psychiatric phase, where now 2 major things happen here. One, kuna detox, which takes about maybe either 3 to maybe 10 days, depending on the substance of abuse unatumia. Now after detox, now tulikuwa tumesema now this psychiatrist anamuona, anaangalia, amefanya assessment yake, anajua which medication should we put this client on. No, so this client is on medication. Now number 2, now he begins his detox process. But don't forget, there are 2 types of clients here.
Yes.
Now we have one who is on voluntary basis. Number 2, we have a client who is on involuntary basis. Now these 2 clients, during the assessment, we are very keen to check on them, who is on the voluntary basis, who is on involuntary basis. Now we have to do a lot of work, especially on this client who is on involuntary basis. I know you're asking yourself, why? Now let me respond to your curiosity. Why?
Yes.
Now, because this person has a lot of resentment, a lot of denial issues with the person who brought him or her into the facility. So now the work of the counselor here, and the work, especially the work of the counselor, it is to help this client break this person or walk this person from denial to acceptance, because we say that healing begins with acceptance. Yes, healing begins with acceptance, and breaking that, cracking that nut from denial to acceptance, it takes almost 1 month. Now the second month, or the second phase, we call it now the rehabilitation phase. Now why? Because the first month, this client has grown or has developed awareness. Where am I? Why am I here? What am I doing here? So now they begin the rehabilitation process. Now during the second month, now they are together. Most of the time they are with the counselor and they begin their sessions dealing with what? The underlying issues. At the first month, we are focusing on the presenting problem. Maybe chenye ilikuleta kwa program ni pombe, ama maybe behavioral issues, ama mental health issue. But now in the second month, tunaangalia nini hili contribute to the presenting problem. Now the last month, now we call it we focus on 2 things: the exit plan of this client and also the relapse prevention of this client. Yeah, basically that's how the programs work.
And what about the outpatient?
Now when we talk of the outpatient, okay, much of what is done in inpatient, it's similar, the same, but now for the outpatient, you see, now this client is coming for the sessions, during an appointment, on an appointment. Maybe you have discussed with your counselor, you be coming once in a week or twice in a week, depending with your issues or depending on the presenting issue. So there's no much much difference between the inpatient and the outpatient. It is that huyu ako hapa ndani,
ule ako nyumbani, so ni kukuja,
huyu tu anakuja. So ule ayuko in a controlled environment. You're getting it. Now let me give a good instance. Now we have 2 individuals here with the same problem. Now one, client A akona alcohol or substance-induced disorder. Client B has the same. But now, when there are factors we consider before admitting this client or before making a decision, who you client A maybe ni wa inpatient, client B ni outpatient, right? Now for this outpatient, tutaangalia now pale hapo home or in the environment, are you safe? Do you have a support system pale nyumbani? If you feel you're okay and it's okay. And number 2, it's also maybe something to do with the cost. Are able maybe to cater for the inpatient program, because for the inpatient program it is expensive compared to the outpatient. But now one key thing, it's also on are you responsible enough? Are you motivated? If you are responsible and motivated, meaning for the outpatient, and also discipline. Maybe you see these two clients, they have the same issue about the substance-induced disorder. But client A, who you are outpatient, are you disciplined? If you are given an appointment, will you come on that day you are given on time? Will you be there? Number 3, pale zile triggers hapo nyumbani, will you be in a good position to deal with them? So if among other factors that we consider, if you are good and you feel you can, then we are not to be on the outpatient program. Yeah.
Fantastic. So let me take you back kidogo. Kuna mali umesema 3 months. Yeah. So how long does an inpatient anakaa kwa rehab?
Wow. That's a very common question that comes up because especially during when maybe mzazi anapiga simu anauliza mtoto wangu nampenda, atakaa hapo for how long? And I think you have had this notion. I don't know whether it's a fact or it's a myth. Maybe our viewers can tell us that it takes 7 years to take bang out of someone's mind. And let me explain. Now, basically, there's no time, there's no fixed time frame that one can stay in a program. There is no. But now, it's recommended. When you check on the World Health Organization, they will tell you there are factors to consider if this individual needs to take up or sign in for an inpatient program, like what I discussed, the responsibility issues about issue to do with support. You have a good support system. Issue to do with also like the severity of the problem of your condition. Is it mild? Is it moderate? It's severe. Because if it is severe, then inpatient program is recommended. Now, when you come to the NACADA, they will recommend go for an accredited facility that offers these services. So there's no like time frame for one to stay in an inpatient program. But basically what I shared earlier on how we divide it for this like minimum time that we give, and it's recommended is 3 months, the 90 days. And you see now in those 90 days, there are things that they are done in each and every month. So it's a process. It's a process.
It's a process.
It's a process.
Munasikia, we are learning. Thank you so much, sir, for coming. Now, I have this question. Umesema kuna watu wanakujaga, wengine wanakujaga like mimi nakuja, na kuna wengine families wanasema no, we are taking now our relative, our son, our daughter to rehab Changuvu. Now, how do families know the best fit, the best program for their loved ones?
Wow. In fact, let me say this. Our Juangi, they don't know.
They don't know.
Most of them, they don't know. So ni kubahatisha. Because at times you get referrals. Oh, I took my son to this facility. You can take yours to this facility. Or I took my loved one to this facility. I think that facility is good.
Yes.
But thank you for this show, because it's now enlightening us to know which are factors that we need to maybe look at.
Yes.
So that now we can come into the conclusion that my son or my daughter or my relative needs an inpatient program.
Yes.
Now, so let's begin from there. Huyu mzazi, if akona information what happens in a facility, then I think making a decision to take this son or this daughter or this relative to that facility becomes very easy. Now, you have said you have asked a very good question. How do they know which is best for them? Fit, na nimesema uwanga wanabahatisha.
Okay, hawajuangi hata wao wakikuja.
Hata hawajuangi. Because most like let's say 80% you find involuntary cases. And the method that is used to our viewers, and you can confirm to this if you are recovering addict or you have ever been to a rehab, is trickery method. We use trickery method. So a trick is used just to capture you, take you to a facility. Maybe unaambia, oh, tunajua aje tunaenda mahali fulani. Come to realize unajipata huko kwa facility. And that's happened. Nilikuwa nasema we have now to deal with that in the first month to ensure this client understands and kwenye yako na kuje to realization nini imeniweka hapo, because most of the time you realize hawa watu wale in denial. They in denial. In fact, let me mention this, the step work in the program, because the first step, we have 12 steps in recovery, of which they are taught. And the first step talks of that I came to admit that I was powerless over my addiction and my life and become unmanageable. In fact, hapo tuna focus 2 weeks. The first month we used almost 2 weeks to crack that step. Ndio tusaidia huyu mtu akuje to, because admitting is now step inasema I came to admit. So there's kuna mahali unatoka mpaka ufike hapa I came to admit that I was powerless over my addiction and my life had become unmanageable. So biao hajuangi.
So wakifika basically mtu akifika kwa facility ndo wanajuanga
because during the time ya inquiry you explain to them. Hapo sasa ndio wanajuanga, hey, and my son or my daughter enye anahitaji this program.
Fantastic. So tutoke kwa inpatient kidogo. Now tukuje kwa outpatient sasa. Huyu mwenye ni kukuja na kuenda. Hakui managed hapa around. Now how do you monitor? How do you monitor those patients who are outpatient? Yes, how do you make sure like you've monitored them now and follow 100% what you guys are telling them?
Now, hapo sasa kuna kibarua. But you see, huyu client wa outpatient ako self-motivated. So the driving force here, it is self-motivation. Yeye mwenye amesema, I need help. So I have a counselor friend of mine ananiambianga, even before ampigie simu, this client will call and ask, unajua leo ni siku ya nini session.
Sasa ni yeye anamkumbusha.
You see now, tunasema they are motivated.
Yes.
Now umeuliza how do we monitor? Now during the sessions, allow me just to break.
Yeah, it's all
maybe in the counseling session the stages. Personally, I cluster them in these 5 stages. Number 1, kuna akikuja, you build a rapport with this client. Muna build rapport. Then number 2, as a therapist, you create a very conducive environment for this client. Number 2, then now the next session or in the same session, you will do history taking. Nini hii imechangia hizi shida zake zenye amekuja nazo, so you take history. Number 3, now you set goals, because now goals gives you it's like a road map. Where are we heading? Where are we coming from? Where are we going? Now number 4, the 4th session, muta evaluate. To reset in our previous session to reset the goals. Now in the 4th session tunaanza ku evaluate how far are we to achieving our goals. Now hiyo sasa on how to monitor them. Yes. It's the goals. Now before I forget this, yes, after every session you give them an assignment. Take an example, huyu mtu ulikuwa umemwambia let's take an example with a substance abuse na ana feel is able to manage, yes, akiwa pale nje. Yes. Now as very simple assignment. Now identify the triggers. After me identify the trigger, maybe in the next session hebu niambie the triggers that you identify, how are you able to deal with in this week? So hizo goals zinakusaidia ku monitor and evaluate how far are we. Kuna mwingine atakuja kwambie, but then unajuanga kuacha sigara is very difficult. Unajua hivyo? Wewe unajua it's not easy. Akuja kwambie, hey, unajuaje my therapist nilikuwa natumia a whole packet, but now I want to cut down. And some of them they are very honest. Anakuja kwambia, hey, unajuaje this week nimetumia 210. According to you 10 is still a lot. Yes. But you keep encouraging. Yeah. You keep encouraging. Yes. So the next one akwambia, hey, unajuaje this week nimepunguza nimetumia like 5. So now you still una monitor, una check the progress. But zile assignments hasa ndizo zinatusaidia kujua are we making any progress. And mark you, the moment you start a session with this client, you'll be seeing the changes. Utakuwa unaona changes. Alafu don't forget this. Now in the recovery we always emphasize on the support system. Lazima muulize, okay, who is in your support system? Yes, yes. Who is, because someone holding him or her accountable. Ukishampa assignment, yes, akienda pale who is kuna mtu anafollow. Yeah. So that's how we go about it. Yeah.
Fantastic. That's a good that's a good job. Actually, I thought the outpatient ones they are more difficult to monitor more than the inside ones.
Sure.
Juu wenye inpatient wanakuwa monitored like wako kwa facility ndani 24/7.
Yeah.
You know. Now let me ask, what advice would you give a family that they are afraid for these rehabilitation programs? Wanaogopa.
Yes.
So you can tell them like you guys, you've heard how these programs work. Now what advice would you give someone mwenye anaogopa hizi rehab programs?
Don't fear. So number 1, what I will tell these parents, don't fear.
Don't fear.
Your son or your daughter is on the safe hands.
Yes.
Number 2, if you still have that fear, pay a visit to the facility. Ukikuja hapa tutakuexplainia how more about the program, because what you know helps to deal with the fear, because fear in fact it's more of an anxiety because the fear of the unknown, because ujui huyo mtu ukimpeleka hapo, yes, what will happen to this hand? Will he still recover? You see now, the reason as why these parents fear, it's because of they have seen maybe others have gone through the program but it has not worked for them.
Yes.
Not that this program, it works if you work it out.
Yeah.
Yes, it works if you work it out. You must be willing to work it out, hence it will work. But if you are coerced, if you are forced, kidogo, it may not work. But it's recovery, it is possible. Now we have seen people who have gone through this facility and other facilities peer, and they are still sober. So it's possible. So the only way to deal with the fear, come, we deal with that fear kwanza. By explaining to you what happened in the facility. Kuja pia wewe ujione unapeleka mtoto wako wapi. Exactly. By the way, kuja uone kwenye atalala, chenye anakula and all that. And let me tell you something, NCP, I've been here, I've had a friend here, so NCP iko sawa kabisa. To anyone who akona hiyo fear ya sasa tukipeleka mtu wetu sasa si kama amepotelea, ni kama ameenda Mathare. No, we want to remove that notion that rehab si Mathare. Rehab is a home. Na mtu wenyu ama mtu wako atatoka vizuri sana. So tukimalizia Mr. Mugo. Yes.
You have said, these patients who are either inpatient or outpatient, they need, support system. Now, what message do you have to those families, that parents supporting their loved ones in recovery, kwa journey ya recovery? So, what message do you have to those families?
For those who are supporting in the recovery?
Yes.
Wow. So, number one is to affirm the good work they are doing.
Yes.
Because this is what I say, and mostly during the psychoeducation, I focus on this topic, relapse prevention. And this is what I always tell these dear ones, that support system is key in the recovery. Because if recovery needs to happen, let me go back nyuma kidogo.
It's all right.
By saying this, that addiction, we say it's a family disease. And this is what I always ensure during the first family therapy, that this family need to know that the entire system is sick. This person is only identified individual in a sick system. Meaning, if this individual need to be well, the whole system need to be well. And that's why we encourage family therapy. If you have a client who is in recovery and you are called for a family therapy, show up. Because this family therapy, what it does, it helps even to heal the whole system. Because this is what I always say. Si wanasemanga, ukiweka samaki moja akioza, what happens?
Zote zinaoza,
That's what happens in recovery. If these dear ones don't understand that we are sick, if this person get out from the facility or from the recovery program, get back to the system, the sick system, atakojeka. And that's the reason as to why we are having cases of relapse. Very many cases of relapse. But now in NCP, we are so much focused and we emphasize that on family therapy to ensure that the whole system is healed. The whole system is healed. So to any family that is supporting these dear ones, thank you for the good work that you are doing. But so just ensure that you as part of that system, you are well. For this individual to be well.
To be well. Exactly. So as we winding up this program, nataka uangalie ile kamera tena.
Yes.
You're a counselor.
Yes.
Waambie watakupata wapi? Peana namba yako.
All right.
Yes.
Thank you so much once again. My name is Counselor Kevin Mugo. I'm also the CEO of the MACRAG, Therapies and Counseling Services. I'm the CEO of that. And we focus on 4 things. So hatunanga mambo mingi. Mental health, addiction, career guidance, loss and grief. Just 4 things. And how can you get me? In the social media, you can get me Kevin Mugo. Also if you search MACRAG, you've utatupata hapo. My contact, these are my contact, 0791848471. Usiponipata na hiyo, kuna ingine 0795515978.
Thank you so much.
Na physical location, tuko hapa Kahawa Sukari, 6th Avenue, Riverside Court. Ukikuja hapa, utasaidika. Yes.
Kabisa kabisa. So thank you so much sir for coming kwa Inside Recovery. Hapa tunasemaga tunakuja kulearn. Hatujui.
Yeah.
That's why we need counselors, therapists to educate us.
Yes.
Na pia sisi to educate the world. Wow. So thank you so much for your time. I know you're a counselor.
Yes, yes.
Uko busy, uko here and there. Yes. So I don't take this time for granted. Sure. And to our beloved viewers, thank you so much for staying. Thank you for watching Inside Recovery. Tumesoma mambo mangapi leo? Programs ngapi? Sorry, ati mambo mangapi? Tumeambiwa tuko na programs mbili, outpatient and inpatient. Watch this video and usikiza hizo details. So that's it for now. That's it for today and for now. Have a lovely day ahead. Bye.